Great. So we'll start with an agenda just to usher in the session. Okay, so the agenda that we have for today is we'll do an introduction. So this is the introduction that I'm walking you through, just some housekeeping. And then at 6:15 to around 6:45, we'll have an introduction to Flavian, who will take us through the context in terms of the climate, health, and mortality. And then we'll get to hear more about the APHRC approach. And then we get into the challenge design and preparation, which Joel will walk us through. And we'll have some Q&A and we'll wrap up the session, which I hope you guys are excited for. Just to acknowledge APHRC, for being the data partner for these challenges. And actually, this challenge is going to be the easiest, and it's already on Zindi, so it's already live. So you might want to go and register because it's going to be the beginner challenge. So it will be easy, and you want to participate in this one. So go to Zindi. I think Jolie will also show us how you can locate the challenge and sign up or register so that you are aware of any communication or when the challenge launches, you are ready to get started. Yes. And just know there are also practice challenges that are going to be that are currently on Zindi that you can use to practice as you prepare to do the final challenge or the main challenge. Nice. So I think without further ado, I'll just check if Lavian is here.
Yes, I'm here.
Okay, great. Maybe you can say hi, introduce yourself, and maybe walk us through the second agenda item.
Hey.
Hello?
Hello. Yeah. Can you hear me?
Yes, we can hear you now.
Yeah. So my name is Flavian Otieno. I'm a data scientist at APHRC under data science program, and I'm happy to be here today. So should I just start off?
Yes, please, you can share your screen and then we can
All
get
right.
started. Yeah.
Okay. Just give me a second. Mm.
Let me give you co-host rights just in case you want to share your screen.
Let me know if you can able to see my screen.
Yes.
Let me put it in the slideshow. Yeah. So good evening, everyone. So as I said, I'm Flavian Otieno, and I'll take you through on that's the climate, health, and mortality. That is the why is it like a climate and health? How is it connected? And also the APHRC approach on how maybe do connect this climate and health and also the mortality data, so that at least you can have one time series data. So my outline is, I think my first point is on why climate and health. And also the second one would be the climate mortality pathway. Like how does the most of the climate exposure, we have different exposure, we have temperature, rainfall, heat stress, we have heat wave. Nowadays we have the air pollution, that's PM 2.5. How is it being linked to health outcome. And then I'll walk you through the APHRC and the Inspire network. This is where mostly we get our data from. And also like our data, how the data is being linked with between climate and health, and also about just a brief overview about the challenge opportunity. So to get started, so the climate and that is the climate change. It's more like it's a more global issue currently, and it majorly affects like low and income countries, especially the African country that's most being impacted. And there's these statistics about they recently project that climate change is going to cause about 250,000 additional deaths, and this is going to happen every year, I think by 2030. And 90% of these deaths occur in low and middle income countries, and also I think the Sub-Saharan Africa. So Sub-Saharan Africa is the most vulnerable region, and it has very least equipped evidence to respond to this exposure and also the risk. So like how climate, so how can climate or how climate becomes a health risk factor. So here we'll just look at the major pathways that's between climate and health. And most of the time we see like a climate is it is indirect cause of these health outcomes like mortality. So there's a pathway, there's a mediator variable that comes in between the climate and the exposure and the outcome, that's the health outcome. So a good example is the heat pathway. So let's say we have like a rising temperature, that's high temperature. So we normally have like a high temperature is being associated with heat stress, and this leads to an health outcome like a cardiovascular diseases like stroke. And looking at the rainfall pattern is an example of a flood, the flooding pathway. So when we have flood, it leads to a contaminated water, and this leads to diarrheal diseases, especially the waterborne diseases, the cholera, diarrheal diseases. And then the air quality that is on the particulate matter. So when we have increased air pollution, so this leads to an increase in respiratory diseases, and all this is being linked to climate. And looking at the gap, what's the gap that's here in Sub-Saharan Africa? So we see like there's a limited integration, that's the health data set and the climate data set. So a good example that is the data set that's mostly used, I think we have the HDSS data sets, that is health, demographic, and surveillance system data. And also we have the DHS2 data set. But in this particular presentation, I'll just focus on HDSS data sets. So the HDSS data set, these are there are longitudinal population data that's being collected from households level in a specific surveillance area. So they normally collect data ranging from demographic factors, that is deaths, births, the verbal autopsy data, the health data like the disease occurrence, the hospital visits, the hospital admissions, and also the maternal and child indicators. So there's a limited integration here in Sub-Saharan Africa on health data sets and climate data sets. And despite having like a policy makers using this data set to inform evidence, there's a potential gap, and this is majorly like the potential gap that's being understudied in Sub-Saharan Africa in climate and health outcomes. And so why is it important to link these climate and health data sets? So first, it is very essential to understand how this climate change impacts population health over time. And also it helps us to develop evidence that helps to mitigate climate-related health risk. and also to improve planning and resource allocations. That's to address climate-sensitive health issues. So I'd like to talk about APHRC and also the Inspire network. So the Inspire network, this is just like just like an entity that's within the APHRC that help us to connect with these HDSS sites within Africa. So first, let me start with the APHRC. So the APHRC here is just like it's a Pan-African research institution it's headquartered in Nairobi. And also we have office in Senegal, Dakar. And our main vision is to transform lives in Africa through research with a mission of generating evidence, strengthening research and related capacity in the African research and development ecosystems, and engaging policy to inform action on health and development. So most in our data sharing, we normally commit to open and fair data principles that is findable, accessible, interoperable, and reusable. So under the Inspire network, so it's just abbreviation, but in full it means implementation network for sharing population information from research entities. So as I just said, the Inspire is just a collaboration between the HDSS sites within Africa, but under the APHRC organization. So they normally they collect longitudinal population health data, and then there's a follow-up. They do follow-up population after every round just to update their information if there is any migration, in migration, out migration, if there's any death that has occurred within the community, and also the birth, if there's any like additional population, and also the health outcome. And the way each dataset is being collected, it's unique across each datasets. It's unique across each countries. Some countries do link their population, that's the community, to the available local clinics and hospitals, so that they can collect hospital visits, hospital admissions for that particular person. So it's individual level data set across time, and also based on the nature, like the beauty about this data set is that the way it has been designed, it's a longitudinal data set, it enables that linking of the climate data to these health outcomes. And these are several ways on how you can link these data sets now, depending with maybe what's your key outcome and what are you looking at. And I think I'll talk about that in my next slides. So here I just want to show like the HDSS. So the HDSS which are under Inspire. So we have like about like okay, I don't have the exact number for the HDSS sites, but we have collaboration with North Africa, we have South Africa, Mozambique, Central East and East Africa, and also West Africa. So there are so many. And this is just a sample of maybe we're trying to look at the heat waves across these HDSS sites, just to see like which particular HDSS sites or country they have more, like they experience more heat wave across the year. So here I just want to talk about maybe how is this data being collected at HDSS sites. So as I said, the HDSS sites, they collect data like they collect demographic data, health data, and also the verbal autopsy data of an individual living in that particular geographical area. So like climate data here, so there's a way we can get climate data for us to enable us to link with that particular health data. Because the data we are getting from the HDSS sites, it's purely health data. It does not be integrated with climate data. So for climate data, we normally like we have to look at the available, is there ground weather station in that particular HDSS sites. So if there is if there's no any weather station that HDZ sites, now it forces us or maybe to use the remote sensing climate data, such as the ERA5 data. We have NASA to at least to download data, climate data for that particular area, and linked it with the health data, just based on the type of the exposure we're looking at, because we have different type of exposure. Maybe you want to look at the heat stress, and that's when you have to consider having universal thermal climate index data. You also want to look at the drought. That means you need to have the SP high. And also maybe you have to look at the heat stress, not the heat stress. You want to look at the air pollution. That means you need to have the particulate matter 2.5. That's there for air pollution. So for this data set, we normally, if we want to download the climate data, we need to have like a coordinates for that particular area, or maybe the shapefile for that particular area to enable you to download data for that particular area in these open sources like OpenAS climate dataset. If you can just write a JavaScript you write a JavaScript that is using the Google Earth engine, it will just give you the climate data of your based on the temporal resolution of your interest. And then the linkage and harmonization of this, sorry about that. The linkage and harmonization of this particular data set. So that is how do we link the climate and health data. So for us, it depends, like for example, like our autopsy data, which I think we have used the VA data for several times. So we normally use that is the date of death column that will guide us. That's the day the death occurred of that particular individual. So we use it to link with the exposure. So let's say, for example, we have a verbal autopsy data of, let's say, between 2000 and 2020 or current, and these are daily events. So we have to download the climate data that's from the same period and link it with this health data using that date of death that will guide us to come up with a time series of climate and health data. So for the verbal autopsy data, is just like this just information that's being collected from this health and demographic surveillance site on those people, then collect information about the deceased, on the symptoms that was associated with the cause of death of this particular individual. And they normally use this probabilistic approach that's called the interview approach. That's normally used to give the most likely cause of the death of that particular person. So based on the challenge, why do we need to use a more sophisticated approach of maybe analyzing the climate and health data? And a good example is why machine learning, and why not just any other statistical approach? So first is the pattern or maybe the nature of this climate and health data. So the climate and health data is normally is a nonlinear. There's a nonlinear relationship. The relationship between climate and health is not like a straight line, and this requires us to use a more advanced approaches to come up at least to see the association. How is climate being linked with the health outcome? Is it mortality or maybe the health outcome of your choice? If you're looking at the malaria, the stroke, the respiratory diseases, how is it linked with climate and health? And in my experience, what I've used is, for machine learning, I've tried to use just to look at how is the different they give us like socioeconomic factors with the climate versus how is it linked or how is it drive a particular outcome. Like let's say, for example, the stroke, how is it being associated? And for the another approach that I've used is called a distributed linear model. So it's just used like it shows the association. How is the association between climate and health? By it incorporates the lag effect, whereby you're trying to see the exposure, like how is the exposure, this being exposed to this particular hazard or the climate stress. How is it like when are you going to see, or when is the increase of that mortality is going to happen? Let's say, for example, you have temperature range from 18 to 30 degrees Celsius. So it will tell me like on which particular temperature are we able, or is there like are we going to see like an increased risk of mortality? Let's say it's a malaria mortality, like it's a temperature between 28 and 29, and also like with that you need to know like the biological mechanism. How is climate being linked to malaria, and also the parasites, the mosquito, the habitat, for you to get to see the symptoms and also for the mortality to occur. The spatial heterogeneity across diverse geographies is also another challenge that we cannot capture with the simple methods, and it requires us to use more sophisticated approaches for us to see that. And also the interaction effects between multiple climate stressors. Let's say, for example, you want to look at the compound hazard of a particular health outcome. Let's say a compound between the health, you want to see both health and flood. How does it lead to an exposure like a foodborne diseases? And doing that with just a simple statistical approach is not like an easy, due to the nature or the structure of the climate and health data. So what can machine learning do, or these advanced methods can do? So first, it helps us to detect the complex relationship, that's the nonlinear relationship between the exposure and the response pattern. And also it helps us to identify the mortality signals across climate and also within the time. So we can see within particular years there was an increased risk of, let's say, a particular disease, and this was being associated with this and this particular hazard. So it helps us to see that relationship clearly. And also with machine learning or any other advanced methods, you can easily handle high dimensional data with many covariance data. For example, like health data. Health data already has many covariates, and you are going also to link it with not just one exposure or one climate data, but several climate data, because you can see like just maybe to try to put in the confounder and to see the effect, so that at least you cannot get the biased results based on the outcome you are focusing on. And also it helps us to deliver insights that really helps to translates to policy actions, and also evidence that can inform policy. So I think that's the end of my presentation, and I'm happy to take any question.
Nice. Thank you so much, Flavian, for that amazing walkthrough. Do we have any questions around the presentation, or any question you might have around the challenge in terms of what the data will entail, given that Flavian has walked us through climate and health, and what we'll be expecting for the challenges? You can also put it in the chat and we can circle back after the presentations. Okay, Paul, feel free to unmute.
Yeah, thank you. And thank you, Flavian, for the presentation. Yeah, so my question was, I wanted to understand if there is a particular target that you hope to predict by combining these two data sets, or is it rather about understanding the different relationships that exist and extracting out insights from the relationships that you can make out? So the question is between getting insights from the relationships, or are there certain targets that you have already identified that can be predicted when you combine these two types of data?
Shime,
I'm
I don't know if
Flavia.
you can.
Oh,
Yes. Yeah, thanks for the
there's a
question.
bit of feedback.
Yeah, I think it's coming from Shime. I don't know if you can mute.
Oh yeah. Let me just.
Okay. So Paul, for based on the data set, or maybe the combination between the data sets, what I've identified to look at. So currently I've identified to look at the real diseases, and I'm going to use the integration data set, that's between climate and mortality data set. So I'm going to look at the deaths that is being associated with the diarrheal diseases, and I'm going to predict it with the use of the machine learning approaches. So I'm going to incorporate like a different machine learning approaches, and then just look at the one which will give me like the better accuracy. So that's what I'm thinking about that challenge on, and I think I'll have like the clear research question on what I'm trying to do. But what I've identified the outcome is the diarrheal diseases, but the clear research question is what I'm trying to derive, so that at least by this week I'll have a clear research question on that. So I don't know if I've answered your question.
Yes, yeah, thank you.
Great, thank you. Any other question? Yes, Adrian.
Okay, hello, and thank you. Thank you for that presentation. My question would be, a bit of context maybe when investigating the effect of climate and health, that is to an individual or a certain population, and this disease, yes, it's affected by climate. Let's say, like, we can talk of malaria, not malaria per se, cholera. Let's talk of cholera. And cholera is affected in areas. We find that areas where there's flooding, cholera comes up. But then the main factor that I don't know, maybe there could be other factors that lead to that, but I believe the main factor that causes cholera is not good hygiene, improper hygiene. So when talking of now investigating this effect of climate, mortality, and particularly this disease in terms of climate, where now does do these factors that majorly cause the disease, are they accounted for when let's say modeling or maybe trying to learn from these relationships? Do they what part do they play that are not climate related?
That's a good
I don't know if
question, Andre. Do you have another question, or should I continue? Yeah. So that's a good question, Andre. So for the example of the cholera you have given, so first I think what you need to understand is climate always is an indirect cause. is a direct cause of an outcome. It's not a direct cause because we have like a mediating factors that comes in between that leads to that particular outcome. So for cholera, we need to have like so that a flood will appear. Yes, we'll have a flood, and then the flood will contaminate water, and then it will lead to those like I think those are waterborne diseases. And then there are other factors that comes in. Then other factors, then these factors include the wash, remember the hygiene of that particular person. So these are now like we have to treat these factors as a confounders. We have to add it in the model so that it will help us not to get the biased results because we'll control with these confounders because like it's being associated with an outcome, but now you get the wash is directly associated with the outcome, but climate is indirectly. So there's that pathway that we normally have to understand between climate and the outcome. So we need to consider and incorporate them in the model whenever we are doing our analysis. So if you fail to include it in the model, so we normally try to do you cannot do like a causal relationship. Like climate does not directly lead to that particular health outcome, but it is indirectly due to other factors in between. Those are the mediating factors. Does that answer your question, Andre?
Thank you. Yeah, Geoffrey, you can go. Geoffrey, you have your hand up.
Hello.
Hello.
Can you hear me?
Yes.
Okay, thank you. So I would like to focus on the issue of mental health disorders. Like, do you think to what extent can these machine learning models can integrate the climatic data in predicting the prevention of mental health disorders? Is that clear?
Like, come again.
Let's focus on mental health disorders.
Yes.
Mental health issues.
Yeah.
So to what extent can these machine learning models can integrate the climatic data in predicting and preventing the mental health issues?
Okay. So that is how machine learning can prevent mental health issues. So first, what you need to know is machine learning helps us to predict, like if we have these particular cases. Let's say, for example, the common mental health disorders is normally PTSD, anxiety, and depression. So first, we have to look at what are these key factors that normally leads to mental health outcome, and then a mental health is normally invisible. We cannot see them, and it has been, I think, recently, based on research or based on the literature, it has been associated with the climate change. I think it has increased the mental health, like that is the prevalence currently. And looking at the mental health and the climate data. So what we need to understand first is, based on the climate data we having, which one is more linked to the mental health outcome? Looking at the temperature, like we have to look at the temperature. The temperature is, if we have the high temperature, that is the heat stress. Heat stress can lead to drought, and the drought can lead to crop failure. When the crop fails to grow, we get food shortage, and this food shortage leads to malnutrition. For mental health, we can say we have a flooding. I think flooding is a good example. Flooding leads to, I think most people get displaced by flooding. And then when they get displaced or they're forced to evacuate from where they're living, they have to, I think they have to have this now, the mental health outcome. That's where it comes in, because like their source of livelihood, they can get maybe the source of income, or they're supposed to care for their family. So that's when we see these outcomes. That's it. The mental health outcomes. That's when we see it to starts to develop from these people. So that means we need to first identify the climate exposure that can lead to this particular outcome. But for mental health, we need to have a flooding. And flooding, let's say, for example, first to incorporate flooding, we need to have like a rainfall. We have to look at the rainfall. And a good example is Kenya. So we have to look at incorporate other factors of that's being linked to mental health. And a good example is, for example, we have like the social demographic factors, that is the age, because like between an adult, let's say, and older like the older population, the younger population, there's a way they adapt to these conditions, and there's a way it affects their mental health. And the most vulnerable population here is the older adult. So like how can we use the machine learning now approach here? So if we have we have the data that's being required, we have the outcome, which is the mental health, we have the right climate data, and also we have the factors that like the mediating factors, the displacement, people are being displaced, they lack food, and also maybe like their house, there's like a house being damaged, people don't get the compensation. So if you can integrate all these factors, yes, we cannot prevent mental health outcome, because that is like for the mental health outcome, I think that's where the psychologist comes in, because these people need support. They need like a support, they need like is it the social support for them to reduce the mental health outcome. I think the mental health can only be reduced but cannot be prevented. So that means we need to have the right data set, and we can predict based on the right exposure we are having.
Thank you. Thank you very much. That was so insightful. Thank you.
Great. That's amazing. Thank you so much. Flavian will be on call as we continue with the session. But thank you so much, Flavian, for walking us through, and for the audience for the questions that you have asked. I'll just check the chat. We'll follow up with these questions after the presentation that Joel has for us. So Joel, I'll hand it over to you to say hi, introduce yourself, and then I'll walk us through the presentation, and then we'll get to the Q&A at the end.
Okay, thank you, Delilah. So my name is Joel. I'm a data scientist at Zindi, and my role at Zindi consists in obviously prepping the data for different competition, hosting them on the platform, and monitoring the competition during the time frame of the competition, and yeah, and basically doing some code review and post analysis after the competition. Okay, so I'm going to share my slide and we'll discuss a little bit more about the current challenges that will be coming. They can just present that one. Hopefully you can all see my slides. Please just let me know if you can see the slide.
Yes, you can.
Okay, sure, thank you. Yeah. Okay, yeah, so thank you. I'm going to talk a little bit more about the challenge. Obviously, Flavian has already talked about the data, why this type of work is important, the indirect link between climate and mortality. So now I'm going to discuss a little bit about the current challenge that will be hosting on Zindi and what the outcome is. And I'll also talk about I'll also mention the practice challenge and some tips on what you can be doing from now till the challenge date. Okay. So the main challenge is titled climate. It's climate sensitive mortality prediction. So basically, the idea is a binary classification task, and the idea is to identify which data are linked to climate sensitive causes, whatever. So basically, the data set that you will be working with is tabular data, and the data is from APHRC. So it's tabular data with different features such as demographics, temperature, precipitation, right? And of course, the cause of death was in the original data set. The cause of death is given, but then in the actual data set that you have, that column is removed, and what we have instead is, based on the cause of death, the death is classified as either sensitive to climate or not, depending on what the cause is. And again, as Flavian already explained, it's not a direct relationship, right? It's like an indirect relationship. But then for this beginner challenge, that's what you have. So basically, you have a data set with different features, demographic feature, climate related feature, and then there's a target variable that's specified, that's classified the death as either sensitive to climate or not. And that's basically what you're predicting. And of course, additional data may be required, because in this case, for example, it would be nice to have, based on the location, it would be nice to have some weather and climate information, not just on the day the death occurred, but sometime prior to that. Obviously, like if there were flooding, those type of things, so you can get that data and see what the link there is. Okay. Now, in terms of evaluation, the challenge will be evaluated using two different metrics. So on Zindi, we refer to this as multi-metric evaluation. So one metric would be the F1 score. Yeah, so F1 score is a combination of precision and recall. And there's also the AUC score. So AUC score will, it's basically just to see how well you're doing across all the different decision thresholds. Obviously for prediction, you're predicting. So you have two different targets that you're reporting. One is a binary target, and one is a probability. Now, for the binary target, you're not setting any threshold, right? So it's the default threshold, 0.5. So you report that, and you also report the probability. The probability of a particular prediction. So you report those two. So your submission file will consist of 3 columns, where you basically have an ID. An ID is just a unique identifier identifying a specific record in the data set. And you have 2 target columns. One is a binary target, 0 or 1, and the other one is a probability. Any number between 0 and 1. And when you submit this file, these 2 metrics that I mentioned here will then be used to score your submission and report a score. Okay, so this is basically what, just a high level idea of what kind of challenge you're dealing with. And okay, maybe before I continue, I can actually show you, in case you're not familiar, in case you haven't signed up for the challenge yet, I can share the challenge page in the chat. just so that, okay, let me just share it here. So the link I've shared in the chat is the link to the challenge page on Zindi. So you can, yeah, you can log into Zindi and you can join the challenge, and you can read everything about the challenge there. And yeah, and the challenge starts on the 28th of March. So right now you won't be able to see the data because the data only becomes available when the challenge is open. And there's a chat session. You can ask questions in the chat if there's something that is not clear about the challenge, or if you, so the chat is where you can ask questions. You can also help your friends by responding to their question, obviously. And usually there is a leaderboard. So the leaderboard is just to, the leaderboard help you see how well you're performing. So when your submission is scored, you get a score that is published here on the leaderboard, and you can see how well you're doing, right? And obviously you can make multiple submissions, so you can improve on your work. There's a public score, which is available when the competition is running. And there's a private score, which is only released at the end of the competition. And obviously, this is because the test set is split into two. So 30% for the public score and 70%
Hello. Can anyone else not hear
private
Joe?
leaderboard can actually be used to test how well your model is generalizing. Sorry, was there a question?
I think we lost you for a bit, but it's good now.
Oh, okay. Oh, yeah. So I was just, I was explaining, I was talking a little bit about the leaderboard and the purpose of the leaderboard. So the purpose of the leaderboard is to see your scores as the competition progresses. So when you start competing, and if you've been competing on Zindi already, then you will have seen this, right? When you make a submission, your submission is scored and you can see your score on the public leaderboard. So obviously the nice thing with that is that you have the ability to improve upon your submission. You can submit multiple times, right? So you can keep iterating and improving on your submission. But then of course the public leaderboard is not all. You want the public leaderboard is only being scored on 30% of the test data. So there is 70% of the test data that is kept, and that's used for the private leaderboard. And the private leaderboard only gets revealed at the end of the competition. So this is used to test that your model is generalizing and really performing well, and that you're not simply overfitting and trying to maximize your score as much as possible on the public leaderboard. Okay, so that's a little bit about the challenge. Okay, maybe I should. Okay, yeah, in terms of the format of the submission file, so the submission file is a CSV file, as I mentioned already, where you have, in this case, you will have 3 columns. So the first column is the ID, and the second column is for the binary target. So that's a 0 or 1, and the next column is for the probability. The probability of prediction that you also report. And this format is required, right? So your submission file should strictly follow this format. Obviously, there's going to be some helper code in a starter notebook just to show you how to prep your submission file so that everything works as expected. Okay, yeah, so that was about the challenge. I think I will go back to my slide and also mention the the practice challenge. Okay, so the practice challenge is already live on Zindi, and I'll also share the link to the practice challenge in the chat. So the second link I just share is the link to the practice challenge. And the practice challenge is about, mental, it's about depression. I think somebody was just mentioning something about mental health. Yeah, so that's what the practice challenge is about. So the idea is to predict, based on survey data, predict who is suffering from depression. And in this case, the target is a binary variable. So you're predicting 0 or 1, something like that. So that's the practice challenge. And we can see that some people have already been, taking part. And you can see their score on the public leaderboard. So for this particular challenge, obviously, the closer to 0 your score is, the better. Okay, because the evaluation metric being used here is mean, I think it's mean absolute error. And we are simply, okay, I think, it's actually there. Yeah, so we're simply reporting on a percentage of the survey that are incorrectly predicted as depressed. So, yeah, so if the number that is, if the number that is incorrectly predicted as depressed is small, i.e. closer to 0, then you're doing good. So that's why the leaderboard shows that people with values with score closer to 0 are at the top of the leaderboard. Okay. So obviously the purpose of the practice challenge is, one of the main purpose of the practice challenge is to get familiar with the Zindi platform. For those that are not already familiar with Zindi, so you will get familiar with the Zindi platform. You will before the main challenge actually start, you will know how to make a submission, and this will be time for you to do all that, know how to make submission. And of course, the whole submission process, handling imbalanced data, because most of this type of data is usually imbalanced, right? Where the positive class is usually small relative to the negative class. So how do you deal with that? How do you engineer new features? Those type of things. So those are the kind of things you'll be dealing with. And again, these are the similar kind of things you will have to do with the main challenge. Okay. I think that's basically it. Any question? Any question about the challenge design? Any question about Zindi or how the challenge will run on Zindi? Okay, yes, Paul.
Yes, I just wanted to clarify on the point you made about additional data sets.
Yes.
Yeah, so by that, do you mean that we shall be provided with additional dataset files that can contribute to our model predictions, or do you mean that we are allowed or free to search on the internet for any data we think might be able to support our model?
Okay, yeah, that's a good question. Okay, because right now the data for the competition is obviously everything is you have demographic data, you have the health data and the different mortality cases, and you only have weather information on the day of death, right? So just a single point, just that single point information. But then obviously, if you really want to look at the climate link, I think it will be useful to have to be able to access climate data not just on the day of the death on the day the death occur, but on the time frame around that date and in specific region, right? Just to so you will be able to access obviously whatever data you're accessing should be publicly available. And obviously there will be some recommendation on where to get this data. So you will be able to source additional data to enrich your data set. Yeah. Does that answer your question? Okay, cool. Any other question? Yeah.
Maybe also just a quick observation that on the website it shows 50/40 for the metric metric evaluation.
50. Oh, 60/40.
50/40
okay.
is what it shows on the website.
Oh, okay, good. Okay, thank you. That's a typo. I'm going to correct that. So it means 60/40. Okay, thank you very much. Yeah, you're right. Yeah, I think it's 60/40 because everything has to sum to 100%. Okay, yeah, I'll correct that. Yeah, I'll correct that after the call. Thank you.
Maybe I can follow up on a question on the chat if it's applicable to be answered. What type of data set am I going to use, maybe for a specific country only or the whole of East African countries?
I think the data we have is only from Uganda. I mean, Flavian can correct me on this if I'm wrong, but I think the data is mainly from Uganda, different counties and different locations, but in the same country. Am I correct there, Flavian?
The data set's from Uganda.
Okay.
That's true, yeah.
Okay, any other question?
Maybe just highlighting how you can form teams.
Oh, okay, yeah, sure. Yeah, we can also. Okay, yeah. So you can form a team on Zindi, right? You don't have to work alone. You can work with your friends. So when you form a team, okay, you need to know. I'm on the page here where they say team. You need to know what your friend Zindi username is. So here, for example, if I go to the leaderboard, this is a Zindi username. So that's their username, right? So if you want to form a team, you need to invite, you need to go to the team, click on the team tab. And when you're on team, you need to type name of the team. Obviously, you can create the name of the team, right? You can call your team, I don't know, whatever you want to call it, the greatest or whatever, and then you go create. So you type the name of your team, you go create. And when you do that, you will then be requested to invite people to join your team. And you need to know what their Zindi usernames are. So here, for example, if you want to invite On to join your team, you can just, you will have a cell where you can just enter his username and click OK or whatever, just to validate. And obviously, when you do that, he will receive your request and he will be free to accept or not. So that's how you form a team. So you don't have to work alone, you're free. And I think the Yeah, I think the maximum team size here is 4. Obviously, that can be changed for each challenge, but right now we've set it to 4, meaning that you can have a team of 2 people, 3 people, or 4. Yeah. Okay. Any other question? And of course, you can also have a look at the holes. When forming a team, there's a time frame, right? Like, for example, you can form a team one day. In this case, this is actually just a 1 day. The challenge is only going to be running for 1 day. So yeah, you can form a team. But sometime for some challenges that run over a long period of time, sometime the whole will say that you can form a team like maybe a few hours before the challenge, before the end of the challenge. But I think here you don't have that. You can form a team, yeah, as soon as the challenge starts. And I think you should already be able to form a team. You should be able to form a team if you want to. So, okay. Any other question?
Okay. If there is no other question, Joel, you good?
Oh yes, I'm good. Yeah, that's everything for me.
Okay, great. Thank you so much for that walkthrough, Joel, for walking us through the challenge and what to expect. I think this is just a highlight of the various challenges that will be happening. In case you're interested, you can definitely have a look into it. Did you want to highlight something on this, Joel?
Oh no. So there are different streams, right? Obviously, you're welcome to participate in any number of streams you want. You can participate in all the challenges. There is no restriction. It's up to you.
Okay. Yeah, and they look quite exciting, and I really loved the one that Flavia just walked us through. It sounds quite interesting, so I hope you guys have registered and you're excited to take part, and do take part in the practice challenges just to prepare. And in case you want to attend a physical event, I think there was an email that was shared for you to fill a form so that you can be recommended to one of the locations that will be having a physical meetup. So please do register so that you can plan ahead. Yeah, and for the time being, do work on the practice challenge so that you can at least be aware of what to expect for the main challenge. And again, shout out to APHRC for being the data partner. Before maybe we close, I will just leave again some time for Q&A in case you still have a question. Maybe Flavian, you can tell us your last remarks for the community even as they prepare for the challenge. Maybe one last tip they need to have a look at when they're looking into the challenge.
Thanks. So I think the remark I can tell, I think those people who are going to do the challenge is just like understand the data set and also try to look at which particular outcome are you interested in, and also the machine learning models you're going to look at. Remember, we have several machine learning models, and then some models are robust, some are not. So I think it's always good, also a good practice to compare different approaches so that at least you can get a robust model which can help to predict your outcome, and also it can be used for evidence. I think the evidence you're going to generate will help to inform policy in that particular country, especially in relation to climate and the health. So I wish you all the best in the challenge.
Amazing. Thank you so much, Flavian, and looking forward to the challenge. Yeah, that's it from us. Maybe Jolie can look at the last slide, just to confirm we have touched on everything. Yes, the challenges, the challenge weekend will be on the 28th and the 29th of March, and we do expect a lot of participation. So we are going to be putting your skills to the test as we have shown you the different tracks. So be prepared for that. And again, 30,000 USD worth of prizes to be won. So I hope you're excited for that, and do prompt your universities in case you feel like it should be broadcasted maybe to the whole university so that people sign up and you're ready to win together. Please do so, and yeah, share it within your group so that everyone is aware and ready to participate. I'll just leave room for one question in case there's any question, and then we can wrap up, and we'll see you in the next call. Any questions or follow-ups anyone might have?
Yes. Good evening. Thank you for that, and also highlighting about the hackathon that is set for 28th and 29th March. But I was asking that my university from Mombasa, University of Mombasa, had already filled in the form that was in that invitation letter. But I was asking, I wanted to know the follow-up and how it stands between AI4EAC and my campus, so that I can start mobilizing the students for my department and also other students as well. Yes, thank you.
Okay, great. I can follow up with you on that by end of the week on how we can go about like the logistics of that end. For now, you can just have the students register for the challenge, and then on the hosting, I can give you more context about it by end of week. If that's okay. Raphael?
Yes, thank you. That is okay. So I can start mobilizing students right now.
Yes.
Any materials that I'm using, promotional materials and like graphics and stuff.
I think I lost you. Yeah. Yeah, I think I lost you, but maybe you can have students maybe register for the challenge. As Joel has shared on the chat, they can just register for now, and then once they have registered, they will get a form as that was shared, I think, earlier through the email, in case they're interested to be part of the physical locations, to be into the physical locations. We can then reach out to them from there based on the universities that will have as hosts. Yeah. But thank you for the question. Any other question before we wrap up? Okay, great. If there is no other question, we look forward to seeing you in our next session as we look into other challenges. But I hope you're excited about this one, and it's challenging and yet exciting to work on. So thank you everyone for joining today's call, and see you in the next one. Bye everyone.
Okay, thank you. Bye-bye.